Could you say a little more about survival rates in preterm babies?
When my career first started, the survival rate for a neonate, we used to look at sort of 28 weeks as being uh, a good survival, and 50% of those would survive at 28 weeks, and 50% of those would still have some sort of long-term problems. Those statistics now are really at 24 weeks, and that's how medicine therapies have improved just in the course of my career. So we're looking at 24 weeks in a very similar way to the way we used to look at 28 weeks. And whilst that's ventilation, and a number of sort of mechanical things, it is medicines, it is parenteral nutrition, and it is that general care. It's a much more holistic care now, thinking that we have to nurture these babies. Before, they were just left generally in incubators, and now there is very much more about the way that trying to get the mother, nursing staff, and everybody else to interact. It's still really important to have all of that. It is part of their development, and therefore it's been fascinating in a 30-year career to see that development, and that change in survival.
You mentioned parenteral nutrition. Now, you recently chaired and spoke at a satellite symposium concerned with safe services in parenteral nutrition for neonates and paediatric patients. And my question to you is, why is parenteral nutrition such a big topic in the neonatal world?
Parenteral nutrition is often left as a bit of a sideline in medicines, I think. And yet medicines are all about stabilizing the body so that it works properly. Well, the one thing we take every day which does that is nutrition. And therefore, the importance of it is huge. If we didn't give nutrition, we wouldn't be here. And therefore, it is the ultimate medicine in some ways, that we use. And yet it is possibly one of the most complex things that we give to everybody, but certainly to neonates. I'd like to challenge anybody who thinks that when they're giving an IV, an intravenous, infusion, and they worry about whether they can put it down the same line as another one, and will it interact, and all of these sorts of things. A bag of parenteral nutrition is about 50 different drugs, 50 different elements, and we throw them all in a bag together, and we tweak them, and we up some and we down some, and yet some of those do interact. And the importance of getting it right is huge, both from a clinical point of view and from a manufacturing point of view. And so I think that's sort of what has really enhanced my enthusiasm for delving into it, trying to understand it more, both from a clinical point of view, but also from a pharmaceutical point of view. It is so complex. And, if anybody wants to pour a bag on their tomatoes, it makes them grow. It's an amazing new growth source, and therefore it's one of the worst things to have hanging around at ward level. If you get an infection in there, it will grow, and therefore the sterility of it is so important. Therefore, how often do you manipulate it? Where has it been manipulated? All of these sorts of things, so important. And if you've got it running down a line, well, what's that mixing with? One drug is one thing. 50 drugs and another drug is quite another. And therefore, do we really want to be running things with it? Don't get me wrong, sometimes we have to, but that is a real decision to make. And I think that's where pharmacy really comes into its own. The only people who should really be making those decisions are pharmacy. This is where pharmaceutics, really comes into play. And going back to, why do I love pediatrics and why do I love neonates? It is that combination. It's not just about the clinical bits. It's almost trying to remember what all of those bits that you went to university and learned. It's the chemistry, it's the pharmaceutics, it's the clinical aspect, and it's how all of those interact together. Therefore, I think we have to make the most of all the skills that we learned. I think there were a few years sort of going past university. I wondered why I went to most of the lectures, but as I've gone through my career, I I think I've made the most of most of the lectures I ever went to, and probably wish I'd spent some more time thinking in some of the lectures I didn't spend so much time thinking in. But it is so important. It's what is behind my career, and it's sort of kept the fascination going.
And following on from that, the next logical question is, why are you such an advocate for standardized products?
I think there's a number of things that we have to ensure with standardization. It makes life easy. And far too often we look for complications when there shouldn't be complications. And I think that's sort of one of the main reasons that I do sort of, I'm a huge advocate for standardization. For things like parenteral nutrition, it's easy to say, well, for a lot of things, you can fiddle with them because you've got alarms and things all over the ward to reflect how the patient's doing. Your heart rate goes up, your blood pressure, and all these sorts of things. And if the alarm's gone off, a nurse comes along and they tweak one of the infusions to stabilize it all again. With this bag of parenteral nutrition, there aren't any alarms, and therefore we need to have a standard approach. Otherwise, people are playing around the peripheries without many things, alarms or anything else, going off to warn us what's happening. So I think there is something about the ability or the inability to monitor in the same way that helps standardization. At the end of the day, something like amino acids, which you need for growth and a number of other things, and energy. Well, if you've got far too much energy and it's not doing anything, that will either be laid down as fat or wasted. And if you've got far too much amino acids and not enough energy, well, that'll be needed to sort of turn into ammonia and nasty things to go through the kidneys, particularly in neonates. They struggle to get rid of these things. And therefore, the imbalance is, well, one, it's a waste of time. It doesn't help. If anything, it causes problems. And therefore, standardization, say of something like parenteral nutrition, ensures that the balance is there. If you don't have that standardization, you've got people saying, oh, well, let's have a bit more energy. But if you're going to up the energy, you might need to be upping the amino acids as well. And it's all the bits. Standardization ensures that you give the right proportionality of things. That's with parenteral nutrition. With infusions, we know that at ward level, most infusions are actually made up very badly for pediatrics at ward level. That is no criticism of the anaesthetists in theatres, the nursing staff at the wards, and I have to say that my wife is a nurse, and a paediatric nurse at that. But it's no criticism. But when you're adding a tiny, tiny amount with a large amount, trying to get that right is very, very hard. And there are lots and lots of really good studies showing how inaccurate those are. Therefore, having standard concentrations that are pre-made allows a certainty and an assurance that what is in the syringe is what should be in the syringe. And standardization of things like liquids, having lots of strengths of liquids, people might think is useful, but generally not. And we've done a load of work to show that whether you're a neonate or an adult, for most drugs, you can get away with one strength of liquid. And what is the advantage of that? Well, certainly parents often remember the number of mils they were told to give. keep changing the strength, and they will keep giving the wrong dose because they don't change the volume that they're giving. Therefore, whether it's parenteral nutrition, whether it's IVs, or whether it's oral, I generally advocate for standardization. It doesn't mean it works for everybody, but it does allow you then to concentrate on the smaller proportion that can't use the standards and therefore get it right. Therefore, it takes a huge proportion of the population out of the equation where you're having to think so hard. And that is so important. Put your energy and your efforts where they're really, really needed. And just the last bit on that, for most of those things, it's not about saying that one size fits all. Just because you're standardizing a concentration, you can still give whatever dose that you want. And I think that is really important. And so often the wrong messages get out there to do with standardization. It's understanding what is being standardized and why. But all of the three standardizations that I've just talked about, I think are absolutely important that we look at, try and move forward. We're not there yet. There is a lot more work to do, but that's why I'm such an advocate.